Today is World Osteoporosis Day. World Osteoporosis Day is held on October 20th each year. It marks the start of a year long effort to teach people worldwide about the bone health and how to prevent, diagnose, and treat osteoporosis. Osteoporosis is a major public health concern around the world, but in India, the problem carries an added dimensions. So, every one of us should know what is osteoporosis. The word literally means porous bone. So, osteoporosis is a disease characterized by reduction in the bone mineral density and the mass that makes the bones brittle, fragile, and highly susceptible to low impact fractures, particularly in the hip, spine, and wrist. So, this is the diagram showing healthy bone, and this is osteoporotic bone. So, here we can see the porous bone. So, osteoporosis causes bone to become weak and fragile so that they break easily, even as a result of a minor fall, a sneeze, or a sudden movement. Worldwide osteoporosis, 1 in 3 females and 1 in 5 males aged 50 years and over will suffer an osteoporotic fracture. Osteoporosis is also known as weak bone disease. The International Osteoporosis Foundation's theme for the year 2025, particularly for World Osteoporosis Day, is it is unacceptable, means it highlights the failure to diagnose and treat many osteoporosis patients after fragility fractures. So these are the different stages of osteoporosis. We can see here this is the normal bone. This is osteopenia. Osteopenia means when there is decrease in the bone mineral density. Third is this is full blown osteoporosis in which there is a reduction in the bone mineral density as well as the bone mass. Now this is severe form of osteoporosis. Now here we can see the fracture of the bone after osteoporosis. The theme it is unacceptable is basically a campaign. So what is the purpose of the campaign is to raise the awareness about the seriousness of the osteoporosis. Second important point in the this campaign is to encourage the early diagnosis and prevention. Third is to emphasize that fractures and sufferings due to ignorance or inaction they are unacceptable. And the fourth is to motivate the government, healthcare professionals, and the public to take action. These are some of the slogans for the World Osteoporosis Day 2025. And the first one is Step Up for the Bone Health, means encouraging the individuals to take proactive steps towards the prevention. Second is Say No to Fragile Bones, highlighting the need to prevent fractures and their consequences. And third is to build the better bones, emphasizing the lifelong care from childhood to the old age. Together, the theme and the slogans aim to inspire a united call for stronger bones and healthier lives. Common bones that are affected in osteoporosis, they are vertebral bodies. So we can see here the vertebral fractures, hip bone, hip fracture is there, and the wrist bones. So wrist fractures, common fracture in the wrist is Colles fracture. Again, we can see here this is the normal bone. This one is the osteoporotic bone, and we can see here this is the vertebral column. Again, this is the vertebral column, and we can see here the two compressed vertebral body fractures. So, what are the different types of osteoporosis? So, we have mainly the primary osteoporosis and secondary osteoporosis. In primary, again, we have type 1 osteoporosis. It's also known as postmenopausal osteoporosis. It is seen mainly in 50 to 65 years old females, and it is due to the deficiency of the estrogen. Type 2 osteoporosis, it is also known as senile osteoporosis, and it occurs in men and women more than 70 years of age. And here the predominant fracture is of the hip, wrist, and the vertebra. Whereas in postmenopausal osteoporosis, the predominant fractures are vertebral fractures and distal forearm fractures. This is secondary osteoporosis. Secondary osteoporosis is due to the secondary cause, like nutritional deficiencies. Deficiency of this calcium, vitamin D, and protein can cause osteoporosis. Then certain endocrine disorders like hypoparathyroidism, hyperparathyroidism, etc. Then chronic diseases like chronic kidney disease, chronic renal disease. Then certain lifestyle factors like excess intake of alcohol, excess intake of this caffeine, and excessive smoking. All these they can lead to the decrease in the bone mineral density, and that leads to osteoporosis. Then there are certain drugs, long term use of these drugs like prednisolone, letrozole, omeprazole, pioglitazone, heparin, cyclosporin, tacrolimus, phenytoin, fluoxetine. It is associated with the osteoporosis. The gold standard test for the diagnosis of osteoporosis is DEXA scan. So, what we see in DEXA scan is the bone mineral density. So, this result is read as T score. When the T score is between minus 2.5 and minus 3, it is considered as osteoporosis. Now, coming to the how can osteoporosis be prevented? So, as we all know that prevention is better than the cure. So, regular exercises they are advised. Number one, nutritional supplementation. Third is avoid negative lifestyle habits. Find out whether you have risk factors or not. And to prevent the fractures in a patient of osteoporosis, here we have to take steps to prevent the falls, to prevent the osteoporotic fracture. So, in the prevention part, regular exercise is very, very important because regular exercise keep our bones and muscle mobile. So, there are two types of exercises. One is weight bearing exercises, and second is muscle strengthening and balance training exercises. So, both these type of exercises they increase the bone mineral strength and they increase the bone this strength. Then in the weight bearing exercises, again we have two types: low impact weight bearing exercises and high impact weight bearing exercises. So, here we can see some examples of weight bearing exercises like brisk walking, elliptical training, then stair climbing, gardening, dancing, then this playing basketball, playing tennis, jogging, etc. Again, some strength and resistance exercises. These are some of the examples: body weight squats, reverse lunges, heel raises, wall push ups, and dumbbell exercises. All these are strength and resistance exercises. Again, some examples of bone strengthening and resistant exercises for osteoporosis, like mountain pose, we can see powerful pose, warrior one, standing leg abduction, standing hip extension, etc. etc. Now, there are certain exercises that are to be avoided in patients already having osteoporosis, like toe touch, sit up, crunches, then running, jumping, and rope, and then overhead press with the heavy weight. All these exercises they are to be avoided in patients having osteoporosis. So, what are the best food? What are the best foods for the preventing osteoporosis? So, as we all know that calcium, vitamin D, and protein they are the best. They are the most important foods for the bone health. Now, coming to the calcium. Calcium is very much required for the mineralization of the bone, as 99% of the body calcium is stored in the bones and teeth. Number two is it helps in bone remodeling. It increases the peak bone mass, and adequate calcium intake prevent the bone loss in postmenopausal osteoporotic females and decrease the risk of osteoporotic fractures. Then ideal this vitamin D recommended daily calcium intake is 1000 milligram per day in adults, whereas in females and in postmenopausal females and in elderly patients it is 1200 milligram to 1500 milligram per day. Now coming to the vitamin D it enhances the calcium absorption in the gut and it is essential for maintaining the bone. Now coming to the proteins provides bone matrix formation. They increase the bone strength and flexibility. They maintain the muscle mass and strength, thus prevent falls and major cause of osteoporotic fracture. It enhances the this calcium absorption also. The recommended daily intake of protein is 0.8 to 1 gram per kilogram per day. So these are some of the examples of the calcium rich foods for bones like milk, curd, then soya bean, this spinach, soya, chia, and then oat milk, tofu, etc. etc. So, coming to the vitamin D, the main source of vitamin D is sunlight. So, you can see here, this is the sun. So, exposure, daily exposure of 15 to 20 minutes is required for the synthesis of vitamin D in our body. And then there are certain vitamin D rich foods like fatty fish, cod liver oil, mushroom, egg yolks, etc. So these are some of the examples of the protein rich diet. We can see green peas, corn, avocado, chicken, almond, eggs, etc. etc. So the main source of vitamin D is sunlight. Although we have animal sources of vitamin D, then again we have plant sources are also there. Then we have certain fortified foods that contain vitamin D and supplements of vitamin D. They are also available in the form of tablets. Vitamin D3 tablets are drops. Then avoid negative lifestyle habits like maintain a healthy body weight. Every individual should maintain an ideal body weight. Smoking should be avoided. Excess alcohol and excessive caffeine should be avoided because all these they decrease the bone mineral density and they make the bone weak. So next is find out whether you have a risk factors or not. So there are two types of risk factors. There are modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors they cannot be modified, but modifiable risk factors they can be taken care of. So next is prevent falls. So every individual should practice yoga which are excellent for the balance and strength. And if there are risk factors, the individual is advised to wear the sportive low heel shoes to prevent the osteoporotic fractures. These are FDA approved drugs for the treatment of the osteoporosis. So the drugs for the treatment of osteoporosis they are basically are of three types. The first group is anti-resorptive group. In the anti-resorptive group, the drugs are bisphosphonates, estrogen or hormone therapy, selective estrogen receptor modulators, and calcitonin. Teriparatide comes under anabolic group, and then there is a third group which is called sportive group. So, sportive class includes calcium supplements and vitamin D analogs. Now, these are the tips to prevent the osteoporosis. So, every individual should be encouraged to take calcium rich diet because calcium strengthens the bones and calcium is responsible for the mineralization of the bone. Ensure adequate vitamin D because vitamin D helps in the absorption of the calcium. Do weight bearing exercises and do strength and balance training because both these exercises they improves the posture, they increase the muscle strength and prevent the falls. Smokers should avoid smoking because smoking it decreases the bone mineral density. Alcohol intake should be limited because excessive alcohol weakens the bone and increase the fracture risk. Every individual should be encouraged to take a balanced diet rich in proteins, fruits, and vegetables to maintain the bone and overall health. Every individual should be advised to limit caffeine intake and soft drinks because too much caffeine or cola decreases the absorption of calcium from the GIT. Then, after the age of 65 years, BMD test should be done after every 2 years because early detection helps manage and prevent osteoporosis progression. So, if there is any modifiable risk factors, it should be taken care of. Thank you.